just like that. So very minimally, mostly instead of reducing, I'll be changing the shape of the bone.
Okay.
That's all. So if it's like this, just like that.
Okay, here.
So it's not going to be a major thing.
So here there will be no effect or something.
One small dot will be there for my incision.
Both the sides.
Both the sides.
That will
be less than this. You can't see that only. Here you have a scar, right? This what I'm doing. Scar also won't be there. Maybe like a small punch.
Okay. So like to all those marking to go, how many days it might take when the stitches marks?
We take it off on day 8.
No, that but the
marks might be there for like 2-3 weeks, but for it to totally disappear, it might take a few months, couple of months, 1 month. 1 month after that, nobody really knows that anything is being done to the nose.
So, but the main thing is the stitches will be here down.
Yes.
Nothing.
No. Down also not one stitch will be there, here 1 or 2, and here some 4 or 5. That's not going to be visible because it's going to go under the groove.
Okay. So, like, can you just once again show like how that is? I'm thinking a lot. So.
Okay, come. We will do that. Come to the mirror. So the main issue with you is the relation of the tip and the alar.
Okay.
So which means to say, if you look carefully, the opening of the nose is visible from outside. Yeah. Okay, and this point is sticking out, and it's like a little bit of a trunk. So this is what I'm going to be doing. I'm going to be lifting that tip right here. Okay, and you see what happens when you lift it. Take it a little inside and lift it. So this is how it will come. Like that.
But again, that opening will be visible?
No, it's not visible already, because you see the opening. What's happening to the opening? It's coming down. Can you see? So it won't be visible.
Or like this, it can be like this can be come down and this little push up.
Similar to what I'm saying, yeah. Because your tip is not in the right place. That's why you have the opening out. So we'll take the tip and move it down. So then it won't be visible. This angle, right? See, this angle now is about 105 degrees, and the tip is going up like this. So after surgery, this angle, this will come straight. Like that it will go.
So you mean to say it will come somewhat like
this angle will come down like this.
Okay. Like how many like that it can come front?
5, 4, not a lot. But you don't need to do a lot because I'm going to be working also on this place. So here we will tuck it in a little bit. You see, it's a combination thing in the nose. You're not moving every piece like that, and it's not a measurement surgery usually. The millimeters I'm saying is just for you to get an idea. When we do a bony osteotomy, that's a different ball game. There we do precise measurements and cut the bone and take it back, splint and everything. Rhinoplasty is a surgery of millimeters, meaning couple of millimeters there, couple of millimeters here, and eventually there's a lot of change in the nose. Because the nose has got many subunits. We're going to work on all the subunits and then get the desired results. So when I say 4 millimeters, it sounds a lot, but what I'm trying to say is the difference will there, because even if I move this by 2-3 millimeters and move this by 2-3 millimeters, you get a defect. The difference now you see, this part to this part, it's coming down by about 7 millimeters if you draw a straight line. Okay, so that will reduce by 2-3 millimeters.
5 mm.
Yeah, it has to reduce by 2-3 mm, so the nose looks more proportional.
Because I was just like in the morning, it will lift like this. So
it won't lift exactly, but the ratio, we call this as the ratio of the columella and the alar base. That will improve.
But once done, so once if I get a clear like picture of me.
Yeah, sure.
So because once done, I can't change it again. So
you'll not need to change it again. Don't worry.
Because the thing why I'm asking this is I'm into designing field. So I see before what happens. So
yeah, I get your point. I get your concern.
I'm a kind of person I see before, analyze, then come into reality.
To be very honest, it's a similar kind of thing in rhinoplasty. We have to picture it in our minds, in our plans, and then take the scan. All these things are giving us guidance, but eventually it is your ability to move the cartilage, move the bones, move the soft tissue, because nose is very delicately balanced between the bone, cartilage, soft tissue. Cartilage also 2-3 different types are there. There's a septal cartilage right in the middle, there's an alar cartilage that's a little bit more curvy, and there's an upper lateral cartilage. So all of these cartilages we're going to touch. because only then you're going to get the desired end result. So what I'm trying to say is, yeah, it's a lot of planning, it's a lot of understanding as to what we're going to go, but it's also pretty delicate. So sometimes we are not able to give precise millimeters. Rhinoplasty doesn't work that way actually. I tell millimeters so you understand, because that's the only way I can convey it to you in terms of the amount of change that we're going to bring about in your nose.
But the thing is, this will be little pointy now.
So it will be much more normal looking. It's not going to look like as if the nails are directly seen. So it looks like your tip is protruding. All of those issues will go away, and otherwise it'll be just like a straight nose.
Within 1.5 months, will that what do you say? The muscles and all will become due to pain.
It will heal fast.
Heal fast, right?
Don't worry. You will not be able to see any scar or something within a month. So, like I say, first week is first healing. Second, the first month is second healing. And then 6 months after that is a third healing or the tertiary healing. That will also slowly be happening inside your body. The good thing is no one else will know about it, but you will know that your nose is still a little bit hard. Some people say they still feel the nose, they're not able to pinch the skin and stuff like that. So for everything to come back to normalcy like how now it is, you may want to give it 4 to 6 months. But in terms of healing, for others to know, 1 month is enough. In terms of healing, till when you can have an infection or a problem, 1 week. That's where you let you stay here for a week.
Okay. So after 1 week, I can regularly use face wash and
gently. We let you know.
It will be gentle.
Yeah, it has to be done gently. Yeah, but you will be able to do all that.
So because mine is an oily skin, so if I stay without face wash for 8 or 9 hours, see it might look bright now, but it becomes very black.
So we can that should be possible. We'll let you do that. All right.
Okay. And how about this 1 week? How about I can't touch my face, right? When this
You can, just the nose you can't. We'll put splints, but you can do anything else in your face.
Anything else like how to clean?
You can wash your face.
You can wash your face.
Sure. You can brush your teeth. You can do everything else.
Everything else. But this part?
No, only the nose you can't.
Okay. Yeah.
All right. Good. I'll see you tomorrow.
Yeah. Right.
So, what are you going to do? You're going to have your breakfast early, like I said, 7 o'clock or something. Not a very
any specific thing?
Something light, whatever you want. Not a very heavy breakfast. Come over here by noon, like 12 or so, and then we'll schedule you after that.
Okay.
All right. See you tomorrow. Bye bye.
Thank you.
Welcome. Sherwin